Okay, in today's session we will be demonstrating cupping upon a patient that has an Achilles heel problem. We're just marking the spot. This is a medical pen used to write on the skin. This is the first spot that we're going to cup, but there are 3 spots in total. If the patient has a severe issue, then this secondary spot should also be cupped, followed by this 3rd spot here. But as our patient's problem isn't so acute, this is because he's already been cupped over a year ago when he could barely walk, and since then his problem's been massively improved, and he's just having a follow-up session now. So we're just going to be cupping point 1, which we've marked with the pen. So whilst the cupping process is happening, just thought we'd mention that there are many people out there that are performing cupping today, and there's really no substitute for experience. Our cupping expert here has over 2 decades of experience, so there's only so much you can learn from a book or from going on a course, but there's no substitute for experience, and that's really the best way to get better, through going through to an acknowledged expert as we are here. So we're just cutting the skin. That's the first spot. So this problem, Achilles heel problem, affects mainly people that have problems on the base of their heel, a sharp sensation of pain, like a needle, and they often have to take some degree of medication, like injections. It largely affects people that really wear their tendons, like athletes, labourers, and people that are overweight. So the Achilles heel is basically a tissue that sits in between the calf muscle and the heel. Which is pretty much around the area that we're cupping now. Two typical problems are Achilles tendonitis and tendinosis. The latter comes into effect after tendonitis progresses, and then it leads to a tearing of the tissue. As you can see here, the blood is already beginning to come out, and it's quite thick and very dark. The patient isn't in any distress. It's quite a relaxed process. The first time the patient came, he could barely walk, and he had this spot cupped, and after a few days he regained control of this part of the body. He could walk, he could resume walking again, simply by having a cupping session done. So the cup is almost half full, very dark. So we're going to keep the cup on the spot for between 5 and 7 minutes, which is a bit longer than we normally have the cup placed, which is normally about 4 to 5 minutes maximum. So, as I mentioned in the beginning, there are many people out there doing cupping now, and some of them confine their cupping expertise to cupping certain spots like the back. They don't venture into cupping, for example, this spot here on the foot, on the Achilles heel, or on the head, or around the eyes, etc. They pretty much confine their skill to the back of the body. But as we're demonstrating, you can pretty much cup anywhere, providing you go to someone with much experience and skill. And as I mentioned before, there's no substitute for years of experience. So notice how we didn't place 3 cups on these positions marked simultaneously. We could have done that, but this is not the practice we follow. You will find that that's the case in certain commercial settings where they try to get customers in and perform cupping on them and then off to the next customer. But it's recommended to do one spot at a time, particularly on this part of the body. And you can obviously repeat the same spot again after discharging the blood and recup the spot, but it's certainly not wise to cup more than one spot at a time. So the patient's not in any degree of pain. Cupping expert's got his eyes on the patient's face and expression, and so we're just about to take the cup off. Extremely dark, a lot of quantity and quite thick. Okay, so we're going to dispose of the cup completely. So one cupping session is sufficient here. We don't need a repeat session. Using antiseptic spray to clean the area. So there's no blood, as you can see. On goes the antiseptic cream. Putting these cotton pads. And that's it. Please tell us what you thought of our video in the comments section, and also please do subscribe to our video and show that you liked it. Thank you. Bye.